could you describe an example of a typical project or a typical day?
Yeah, definitely. So there's a couple of projects that I'm working on. But one of the ones that definitely takes up most of my time is right now we are trying to implement a questionnaire in the electronic health medical record that we use called Epic. So for those of you on the call, each time you visit the doctor's office, especially when you're seeing a provider for the first time, you might recall filling out a bunch of different questionnaires, whether on paper or online.
Yes.
So one of my projects is actually standardizing these questions to ask about the different social needs that a patient may have. So the different social needs that we're focusing on right now, because we're required to by Joint Commission, is food insecurity, transportation, utility difficulty, which is whether you're able to pay your bills, intimate partner violence, and housing. So essentially, we're working on this questionnaire that would go out to all of our patients, asking about whether you have any challenges with any of these things. And then if we identify that you do have some kind of unmet social need, what we would then do is train our providers to help connect the patient to different community organizations that could partner with them. So let's say you're a patient that comes in and we identify that you have a food insecurity, you're not able to access healthy food or you're not able to pay for food. We would then essentially write a prescription that enables you to go to a food bank or, get regular shipments of food from a food bank, depending on what the situation is. Let's say you have issues with transportation. We would connect you to some kind of transportation agency that can make sure that you're able to get to your healthcare appointments, get to work, get to whatever commitments you have. So that's probably the most interesting thing that I'm working on that takes up a lot of time, but I also do have a lot of other side projects too as well.
That's really actually really interesting. I mean, you see it, like you said, you see a lot of these different ailments, but there's underlying things going on,
Absolutely.
right? And if you don't address that, you don't get past it.
Definitely. And we've actually discovered through a lot of research that only about 20% of a patient's outcomes are actually tied to their genetics. The other
Wow.
80% is tied to external factors like social and economic factors. So a lot of times traditional medicine and healthcare has been so focused on treating the actual ailment, with medication or whatever it might be, not so focused on what are those underlying causes, as you mentioned. So that's what, gets me really excited about this kind of work.